this is part 2 of the head to toe assessment for the bachelor's program. Alright, Mrs. Smith, I'm going to continue doing my assessment. I'm going to listen to your bruits and see if you have any bruits in your neck on both sides. You stated that you weren't having any difficulty swallowing, no dysphagia, so that's good. Just give me a minute to listen. Alright, I don't hear anything abnormal. Now the next part of my assessment, I'm going to be using my stethoscope. I'm going to listen to your heart, your lungs, your abdomen, and work my way down. Starting with the heart, I'm going to listen for an apical pulse. I would typically listen to this for 1 full minute, and while I'm doing that, I could put my hand on your wrist and compare, make sure that that pulse matches the apical pulse and that everything is equal. While I'm doing this, I would monitor your breathing. I would want to see that you are breathing equally on both sides and that one side of your chest wasn't coming up higher than the other side of your chest when you were breathing. I could also take note of 1 to 2, ratio of your breathing chest expansion, and that you don't have any barrel chest. You don't have a history of COPD or smoking, so I don't think that would be of concern. But I could do all that while I'm listening to your heart. I'm going to listen to 5 different spots on your chest. I'm going to listen for S1, S2 are the main 2 that we always want to hear. Sometimes S3 and S4, which are not good. I'm going to also listen for any murmurs or any clicks that I hear. And I would listen to for these in each location for 1 minute. I'm also going to palpate and listen for your pulse down your leg. I would do it in your femoral, the back of your knee, your popliteal, the inside of your foot, your dorsalis pedis, and then the top of your foot. I want to make sure, I would do it on both legs to make sure that you have equal circulation on both sides of your legs. This is especially important for blood clots or after surgery to make sure that the patient has full circulation all over their body. Next, I'm going to watch you breathe. Again, I'm going to make sure that your chest rises and goes back down equally on both sides. Make sure you're not breathing in too deep or taking short, quick breaths or ventilating of any sort. I'm going to watch the rate, depth, and rhythm. You generally don't ask a patient or tell a patient that you're going to watch their breathing because then they tend to slow it down or speed it up. So while I'm listening to the heart, again, I could take her breathing pattern. I do notice that it's a little elevated at 22, and that could possibly be from the pain. When people are in pain, they seem to breathe a little quicker. I would also know if she was an abdominal breather or uses her accessory muscles. She's an abdominal breather. She, again, doesn't have any history of any lung conditions. I would listen to her lungs on the front, on the sides, and then I would have the patient sit up and I would listen to her back. I would have her cough, clear her throat. If she does cough, I would take note if any sputum came up, and if it did, if the sputum was dry, or if it was productive or non-productive, or if the sputum was just in her throat, or if it actually came out. Then I would palpate her chest while she breathes to try to notice any crepitus or any breathing. While I'm listening to her lungs in all of these different positions, including her back, her upper lobe, and her lower lobes, I would take note of any crackles, rhonchi, wheezing, any type of breathing disorders. She might wince when she sits up if she's having back pain due to the kidney stone, and that's totally normal for this situation. When I listened, her lungs sounded clear, and she was taking big, full, deep breaths, so she was able to get it way down into the lower lobes of her back. So her breathing is good, no complications there. Next, I'm going to listen to your abdomen. You state you've been eating good, having regular bowel movements with no complications, no constipation or diarrhea. I'm going to listen in 4 different spots. You only have to listen for about a minute or so in the upper quadrants and lower quadrants. I would take note if bowel sounds were present, hypoactive or hyperactive. You have to listen for a full 5 minutes to say that there are absolutely no bowel sounds in a certain quadrant. This patient has bowel sounds present in all 4 quadrants with no complications. Her abdomen is flat, non-distended. When I palpate, I can palpate, her bladder is non-distended and non-palpable, so she doesn't have to urinate. She has no lesions, scars, or incisions. She's not obese. Her weight is proportional to her height. I could percuss for tenderness. Now in this patient, I'm not going to do deep palpation because it might hurt her side due to her kidney stone. And I'm pretty sure doctors are the only ones that generally deep palpate if there's complications. But we can do light palpation and feel for her bladder and her stomach. Since the liver sits so deep, I'm not going to reach down into her rib cage and feel for that. Again, as I make my way down, I just notice that everything I do on one side, I'm going to do on the other side just to make sure it's all equal. Since this patient is a woman, I would tell her how to do a breast exam. There's a couple different things she can do. She can put her arm above her head, and then with the opposite arm, she would feel her breast around in a circular motion. Again, with the other side, she would put her hand up and feel her breast around in a circular motion. She would look in the mirror to make sure that her breasts are symmetrical. Notice any bumps, lumps, anything abnormal. Again, the patient we would focus on the one area. Since the patient has difficulty urinating, because it hurts to pee, we would take a urine sample and test it. See if she has any stones, maybe strain her urine. But right now, she's generally a healthy patient. And that is all. Thank you.